update, and you'll notice that I'm not the Health Minister. I just want to send my very best wishes to Tash and her family, unfortunately who have got COVID, but I just want to let you know that they're doing really well and say thank you to everybody for all their well wishes. So today in the Northern Territory there were 831 cases of COVID-19 in the last 24 hours to 8 p.m. last night. 672 of these were from RAT tests and the remainder were from the PCR tests. We've also had to revise up the number of COVID-19 cases by 55 from yesterday, following additional data which came to health, and that raised the number from 867 to 922. At present, in the Northern Territory, we have 7,369 active cases of COVID, and the 7-day average case number is sitting at just over 1,000. There are currently 156 people in the Northern Territory in hospitals with COVID-19. 29 of them are on oxygen, and we have 3 of those people who are in the ICUs. At Royal Darwin Hospital, we have 102 people in there with 25 on oxygen, and we have 1 in the ICU. At the Alice Springs Hospital, there are 41 people there, including 3 on oxygen and 2 in the ICU. There are 5 people in the Katherine Hospital, and there are 3 people in the Tennant Creek Hospital, including 1 of those people being on oxygen there, and 5 people at the Gove District Hospital. So overall, when you have a look at the ICU volumes there today, they are slightly down, which is good news. However, the number of people on oxygen is not surprising, given we do know that this is a serious virus, and certainly some people, particularly those with underlying health conditions, can get quite ill. So in hospital on oxygen, getting the best possible care there. We spoke about this with our Chief Health Officer, Dr. Heggie, and of course Dr. Payne this morning about those numbers there on oxygen and in the ICU. And the number overall in our hospitals and the presentations there. Again, to remind people that many of these presentations are there for observation. These are people with underlying health conditions, perhaps people that have to get renal support and help, but our hospital system is able to manage those numbers there, and this is not surprising where we're at. We believe that we are currently going through that peak for COVID-19, and we expect to see over the next few weeks there will still be that ongoing admission into hospital, particularly with those people with those underlying health conditions that COVID will unfortunately knock around. Now, just wanted to update you on Don Dale. We have had some cases come through there. We've had 9 of the youths in Don Dale and 4 staff members that have gone positive with COVID, and I just want to assure people that we work closely with Danila Dilba, who do an excellent job there, and of course NT Health will be working very closely with Danila Dilba there to make sure that those young people get the possible care. And again, like our Northern Territory government facilities, they have got a COVID-19 plan on how to manage it, and they will be managed there to make sure that we try to minimise the impact there. But again, just to reiterate, there will be close supervision and updates for those young people that are in that facility. Just to also update people on the South Australian flooding situation and what we have seen. I think everybody would have seen over the weekend that the supermarket shelves were looking like they were almost back to normal. There are still certainly some items that you could not get at some supermarkets, but we are seeing essential traffic, essential vehicles that are being escorted by police on the Stuart Highway, single lane, that are able to go south to north to make sure that those essential goods can come into the Northern Territory. The Barkly Highway remains open and we're still getting goods from there, but we're expecting certainly towards the end of this week that we will see that Stuart Highway be able to reopen both lanes, but again very positive to be able to get the escorted single vehicles through that single lane to come into the Northern Territory. Today, really happy to also let people know about how things are progressing with vaccinations of our young kids aged 5 to 11, especially since we've got school that has gone back in. And Territorians are doing a great job, our young kids are doing a great job going out there and getting vaccinated. In fact, We have seen 11,000 paediatric doses of the COVID-19 vaccine administered here in the Northern Territory, so well done to our mums, our dads, our families, and to those young kids who have been rolling up their sleeve to get vaccinated, because that represents 44% of that group here, and that is of the 24,750 kids that we know are eligible for that vaccination. So this is outstanding progress. We're only into day one of the second week of term for those public school students, so thank you to the mums and dads out there, but again the message is clear: get out there, get vaccinated, get our young kids vaccinated, because they are back in the classroom now and they do need to wait that 8 weeks between getting their second dose. So well done, but let's keep getting vaccinated out there. It's also good to see that 87% of kids aged between 12 to 15 in the Northern Territory have received their first dose of the vaccine, and we have 74% of those kids that are fully vaccinated. So again, make sure you go and get that second vaccination, and for those kids that last week became eligible for the booster, make sure you have a look at doing that as well. Again, really important. So when looking at the booster and how it's progressing in the Northern Territory, so far of Territorians, we have seen 38% of eligible Territorians are now boosted. We would like to see that number speed up a bit. We'd like to see more Territorians rolling up their sleeves and getting boosted, because the evidence is clear. If you get boosted, that is the best protection of keeping you as well as you can be through this Omicron wave. So please, we've got great facilities here, like the vaccination clinic that we've got here at Marara. You can go speak to your local chemist if they're doing the vaccine program as well, or your local GP. But most importantly, get vaccinated. It is the best way to keep yourself safe, to keep your family safe, and to make sure we move forward through this Omicron wave. Questions?
Do we know how many students and staff contracted COVID in the first week of school?
Yeah, so the latest details I've got on that, just let me pull my numbers up there, is that currently we've had reported about 670 students across the Northern Territory and 176 staff members. That student number represents 2.7% of the student cohort across the Northern Territory.
So we had about just over 100 subs ready to go. How is those extra gaps in teachers being filled this week?
Every school works the best that they can to deal with sick staff, and it's important to remember that they could be administration staff as well, other support staff that go into a school community. It's not just teachers we're talking about here. So every school has a plan on how they work around it, but I think we all know we're going through a significant wave of COVID at the moment. There will be disruptions from time to time, but schools deal with the flu season every year and sickness all the time, and they have good plans in place on how they manage students through that.
Do you have the number on how many schools were actually affected?
I don't have that number, Zizi, but we can chase that down. But again, 2.7% of the student cohort there.
Being what we believe it to be the COVID peak here, are you confident the Territory can handle this many cases given hospitalisations and oxygen numbers are rising?
So we have got a steady number there at the moment. The important thing is to look at, of course, is that ICU number, and yes, those numbers are people that are on oxygen. But what we're seeing overall with Omicron is that it tends to be a bit milder than some of the other variants of COVID that we have seen. However, the vulnerabilities we have in the Northern Territory, as we know, is that we have a lot of people with underlying pre-existing health conditions. But the feedback we're getting from our Chief Health Officers, who of course work very closely with our hospital systems, is that they are certainly working very hard, and I thank all our health workers for that, but our system can cope with it. And again, we do expect over the next few weeks that we'll continue to see people going into the ICU, and of course to be put on oxygen. But we've got fantastic health staff that will take good care of those people when they do go into hospital.
AMSAT is saying that our hospitalisation rate is the highest on a per capita basis in the country, and it's double that of New South Wales at its COVID peak. Is that accurate to your understanding, or is that surprising?
Well, I would argue that we have the highest level of health conditions and disadvantage, and unfortunately people that live with medical conditions that are problematic in their lives. We have the highest proportion of those people in the country living here in the Northern Territory. So it's not surprising that we do see, with those hospitalisations, a lot of those people just being brought into the hospital system for observation because they do have underlying health conditions. Renal is a good example of that. We have huge numbers of people that need renal treatment here in the Northern Territory. But again, our ICUs have got 3 people in there today. We've got other people that are on oxygen, but our hospital is well and truly geared up, our hospitals, to deal with this, and they are able to.
Given the severity of all the different metrics we have about the Northern Territory, knowing the vulnerability, do you still stand by the comments that were made in July that we should stop catastrophizing through it?
Well, I think we have done our absolute best from the start of this pandemic to manage COVID, and the reason why we've always done everything we can to keep people protected, to give them enough time to get vaccinated, is because we were well aware of the underlying health conditions that people do have in the Northern Territory. We do take COVID very seriously. We have taken COVID very seriously, and we're going to continue to do this because we do have those underlying health conditions. But what I think the Chief Minister pointed out last week, and of course the Territory Controller and our Chief Health Officer, is that with Omicron we are seeing that a lot of this can be managed, self-managed in the home of a person, and we're seeing most of the Territorians that are contracting COVID-19 and contracting Omicron, they are able to manage this at home.
You just said we have to acknowledge that this is still a serious disease, even though it is less severe than Delta. You've also mentioned that Territorians are more vulnerable based off known statistics. Is it then necessary to evaluate the risk as higher than the statistics we're seeing down south?
I think we are managing to the conditions of the Northern Territory. We always have, and we've always taken our approach here in the Northern Territory based on all of those very matters that you just raised, knowing too well the level of disadvantage, knowing too well the level of people that live with health conditions each and every day here. So we're continuing to manage this pandemic and manage the issues out there with the full knowledge of the population of the Northern Territory and the different challenges that we face.
DAMSAT has also today suggested that the Territory's government handling of the COVID pandemic isn't under control, and they say one of the reasons they believe that is because hospitalisations have sat so high above the Doherty modelling prediction of 30 to 100 cases a day. Is it fair to say that Doherty modelling has been thrown out the window because of Omicron, and do you have more up-to-date modelling?
I think, again, it's important to recognise that a lot of the Doherty modelling was initially done based on Delta, and we're dealing with Omicron now, and that presents, like we know, it's highly contagious, but generally people are suffering from a milder illness when they do get Omicron. So our hospital system is certainly it's well placed to deal with what we've been seeing and what we will continue to see over the next few weeks with COVID presentations. So, but make no mistake, as a government, from the very start of this, and we're continuing to do this every day, is we're making sure that we're allocating the resources in the right places. Where we need to change the ways we are managing this pandemic, we are doing so. And we do take it very seriously. But you know, at the end of the day, we have made sure we've done absolutely everything to prepare for this moment in time where we're at right now, where we would see COVID throughout the Northern Territory.
Does Royal Darwin Hospital have enough rats for outpatients? We got in contact with somebody this morning that said they've run out of rats.
So I haven't got any advice around that, so we can get some advice around that, Talia, but certainly we were well and truly ahead of many other jurisdictions when it came to this pandemic, and when it came to getting rats before other jurisdictions, when we've become more reliant upon those tests. Sometimes it can also be a case of the different individuals that you're talking to in any one day and the different information that they've got. But you know, I've got no advice to that point, but we'll certainly go look into that for you.
Given that we are dealing with a new variant, I assume the modelling, as you said, is quite different. Is the government going to release that modelling so we can start to see when they're reaching our thresholds in terms of hospitalisations?
Well, I think we're being fairly transparent, and every day we release the numbers and let you know what is going on there with regards to COVID and the amount of hospitalisations that we've got, the amount of people in the ICU, the amount of people on oxygen. So we're certainly making sure that we release as much information to the public as possible so people can see where COVID is going. And I think what you have seen over certainly the last few weeks is that we have consistently had those numbers up there towards 1,000. The rolling average is 1,000 at the moment for the last 7 days. So we watch it every day, and we'll continue giving you those numbers so everybody can work together to see where it is going.
But I'm not talking about the daily case numbers, I'm talking about our actual capacity limits at our hospitals, given the known variant, given the trend that we're seeing right now.
Yeah, so our hospitals can cope, and they are working towards that at the moment, and if we do end up having issues with capacity, then we'll be talking to the public about it. But as you know, we've had to put some elective surgeries and so forth on hold. We're making sure we've got all those important measures in place so we can continue dealing with the people that come through that need hospital level care that have contracted COVID-19.
Last couple, guys.
I spoke to Food Bank this morning. They've been desperately calling for help, especially in the Alice Springs area. I understand that the Labor government's come to the table with a delivery set for tomorrow. Is this a bit too late, seeing as though they've been out of food for so long? Could we have seen that airdrop? Should we have seen that airdrop last week?
So the advice I've had is that our agencies have been working with Food Bank, and they have worked with them to ensure that they do have access to trucks to get pallets of food up, and that is happening now. But there's certainly been a raft of different conversations happening with government and Food Bank.
There was the death of a man in Tennant Creek that was being reviewed to see if it would be counted on the territory's COVID death tally. Is that investigation finished? Is there an update on that?
I don't have an update on that, so we'll have to take that question on notice so we can get some advice back to you.
And just on Dale, are we expecting more cases there? Can you talk through any of the plans that are in place as part of the COVID management?
So yeah, they're working in different zones to manage the cases. I've certainly spoken to the Minister for Territory Families, and she has been well briefed on the management there, and said they've got an excellent system for managing it. But I think we have to be very realistic here. This is Omicron, and certainly the experience we have seen in other correctional facilities is that despite best efforts and works of cohorting different people that are in those facilities, that Omicron is highly contagious. So most importantly, we'll be making sure we give the right medical care and support to the people that are there.
Do we know if it's concentrating on a particular blockade down there?
Sorry, ZZ?
No, they're concentrating on a particular blockade down there, or is it throughout the two blocks?
I don't have that information, but to say that the discussions I've had this morning, I've certainly had a minister that has been speaking me through that they have got a very strong COVID management plan in place, and most importantly working closely with Tanilla Dilba and of course Health to make sure that people are given the right level of care there that they need.
Last question.
With the initial vaccine rollout, we saw some very regional distribution in terms of which people were getting vaccinated very quickly and which regions were a bit slower. Are we seeing the same thing with the kids' vaccines and boosters? Is there quite a discrepancy there?
What we are seeing is that 44% of those kids aged 5 to 11 across the Northern Territory have gone out and gotten vaccinated. There was a week's lag between the urban centres and the remotes, but this was all planned for, and getting that vaccine out there and distributed and starting to get those jabs and arms. I don't have the regional breakdown of the kids, so we'll go get you more of that information. But still, when you think there are 25,000 kids out there eligible for that vaccination, and that we have now seen 44% of them go out and get vaccinated, that is a pretty good start. So again, to all the parents out there and to the families that are supporting children aged 5 to 11, go out, get that vaccine. I know it can be a bit difficult to sometimes tell your child that going out and getting a needle is the best thing for them. But they are really taking special care with the kids here, making sure that they're comfortable, and in some instances they might even get a treat after they get their vaccine. So yeah, get that booking in, get those kids vaccinated. It's the best thing you can do for your child. Thank you, everybody.
Thank you.